Hi, this is Dr. Worthy, and it's time in the semester to check in with you. You've just finished the sociological part of the course, talking about all the different types of families, and hopefully opening your mind to the idea that the traditional family as we know it, the nuclear family, is no longer the most typical family in America. They're all different variations. Last week, you looked at systems theory in its broadest context. And the reason I wanted you to do that is because systems theory comes from science. It comes from the natural sciences and is applied to families. And so I wanted you to get the full context of what systems theory means. Essentially, systems theory is the idea that everything works in relationship to something else, to other things. So a duck can't be a duck without the forest and the water and the vegetation and things to eat. We don't interact in the world without interacting with other people. And so that idea of having to interact with other people is really the essence of systems theory. The idea that our behavior is a function of our relationships, maybe inside our families, or at work, or even on the road driving. There's a system, and we have to relate to other drivers and interact with other drivers and follow the same rules and boundaries, otherwise it'd be chaos. So systems theory is really a function of our relationship with the rest of the world. Now, my guess is that most of you come from a more traditional learning about psychology and about mental health and about mental health treatment. And that psychology comes from the individual perspective. And that was started by a variety of people, starting with different philosophers, but more recently with Freud, with the whole idea that the way we behave comes from our childhood experience, to Skinner that talks about behaviorism, and the way that we behave is based on our reinforcement principles, and Bandura, who comes from cognitive behaviorism, that talks about the way that we behave comes from the way we think. And all of those things are somewhat true. However, this idea that we all function in a system and our behavior is based on that functioning in the system can also be true. So I would encourage you to open up your mind, because the stuff that you're going to be learning henceforth in the class is going to be kind of different and unique and really a departure from what you've already learned. So you will be thinking of things, well, no, that person needs individual therapy, or we need to understand what happened as a child. And in some cases that might be true, but in other cases it may not. In other cases, maybe we can look at it from a systemic perspective. Because remember, we all interact, and our positive behavior and negative behavior is often based on that interaction. So don't think about it as just a family system, but think about it as a more holistic system, and how we have to, as therapists, think about that and manage that, even if it's with a couple or a child or even someone at work. Again, we can take the systems perspective. So again, hopefully you keep an open mind and enjoy the challenge of thinking about people and therapy in a different way.